Hi, this is Dr. Robert Chao reporting virtually from EULAR 2022 for Room Now. Today is day 2 of the conference, and I wanted to discuss a pretty interesting topic. I think something that makes us all a bit uneasy in the world of rheumatology, which is the question of what to do in terms of treatment for our patients when they carry with them a prior history of malignancy. And this study was abstract. It was actually an oral presentation, 0138, and it's a study from Spain. And it really focused on the risk of cancer after biologic and targeted synthetic DMARD treatment in patients with rheumatic diseases. And this encompassed rheumatoid arthritis, psoriatic arthritis, axial spondylar arthritis, and such. And of course, these patients all had a history of prior malignancy. The DMARDs they looked at included the standard TNF inhibitors, JAK inhibitors, anti-CD20 inhibitors, anti-IL-6 inhibitors, CTLA-4 inhibitors, and IL-17 inhibitors. In this study, there's a total of 9,129 patients that were treated with either biologic DMARDs or targeted synthetic DMARDs, and this is in a large registry. And within the 9,000 patients, 352 had a prior malignancy. They found that in this study, overall, there were 32 incident malignancies, which included solid cancers, non-melanoma skin cancers, and 1 case of melanoma. So overall, the rate of incidence for malignancies was 27.1 events per 1,000 patient years. Some notable facts from this study is that IL-17 inhibitors had no events, and the highest event group was actually in the CTLA-4 inhibitor group. Overall, they did not find any significant difference in the rate of incidence of cancer amongst the JAK inhibitors, the CD20 inhibitors, the IL-6 inhibitors, and CTLA-4 inhibitors when compared to the TNF inhibitor group. Of course, a few takeaways from this is just like most studies that we have, especially when looking at malignancy or prior malignancy, is that there was no comparison to a placebo group. We know that's always going to be difficult with these kind of studies. And I think a few takeaways from this is kind of what we expected, which is IL-17 really had a very low incidence of cancer. I think we can look at it from different points of views, which is IL-17 inhibitor usage here, just like in the real world, tends to be one of the fewest or lowest. And then we also saw that the next lowest incidence were CD20 inhibitors, which I'm sure we're all aware of, which we're a little bit more comfortable using in patients with prior history of malignancy. So I hope this helps you in your decision-making when you are choosing targeted therapy for your rheumatic patients in the future. And thank you for tuning in to Room Now for live coverage of EULAR 2022. And please follow me on Twitter at Dr. RBC. Thanks.